All right, we're going to go ahead and get started. Again, I'm Andre Bailey. I'm the CEO and founder of Project Opioid. Let me make sure my guests are on. Dr. Kendall Cortelyou, are you there?
I am. Hi, Andre.
Wonderful. Thank you for joining us. Dr. Todd Husty from Orlando, Florida, are you there?
I am here, Andre. Thank you for having me.
Wonderful, wonderful. We're looking forward to talking to you guys in just a minute. Go ahead and go to the next slide. We'll start the webinar, and we're really excited about today. We've got brand new data that we're going to share with you on the overdose crisis. And we know that leaders like you are here on this webinar to impact and save lives. So next slide, please. I always like to start by showing the faces of this crisis. Again, we see over 100,000 young people this died from drug overdoses. These are last year's number, but what we're seeing is that ultimately fentanyl still killing more lives than ever, and that's why we're all here today. And that's why Project Opioid exists. Next slide, please. We exist to help impact this crisis. I'm Andre Bailey. Screenshot this if you want to get a hold of me or my team. This is our my cell phone number. This is our email. We're very easy to get a hold of. And I, again, am the founder and CEO of Project Opioid. Next slide, please. Dr. Kendall Cortelyou, we're so excited you're on, PhD. She is the National Data Advisor for Project Opioid. She also runs the Healthcare and Informatics. Did I say that right, Dr. Kendall?
Close enough. Informatics. So School of Global Health Management and Informatics.
Got it. At the University of Central Florida. And so she's going to be sharing today. You don't want to miss this, guys. She's going to be sharing with you breaking data, new data on the overdose crisis that you probably have not seen before, really honing in on the 2022 numbers and what we believe is the most important emerging data on how you can impact the opioid crisis driven by fentanyl in your community. Next slide, please. We'll talk to her in just a second. We also have Dr. Todd Husty. Dr. Todd Husty is one of the leading MAT doctors in Florida, really in America. He is a board-certified emergency medicine guru, and he's also the head of HIM Experts, does MAT treatment at a very high level. Dr. Todd, how are you doing, buddy?
I'm doing great. Thank you again for having me on, Andre. It's so important, and like to follow your lead always.
Well, wonderful. Well, we're going to have a lot of medical questions for you because, again, today we're going to dive into why, next slide, please, why the overdose crisis seems to be increasing in some communities and decreasing in others. And that's going to be incredibly important today. Our webinar agenda, again, is our opening remarks. We're going to talk about the emerging data. We're going to talk about policy changes that we're going to be recommending. We're going to make recommendations to you about these opioid settlements. Listen, cities and counties around America are getting resources in. We're going to talk to you about how you should consider deploying those resources in your community. We're also going to talk to you about some upcoming webinars. We have a really big webinar coming up on veterans who are struggling with the opioid crisis. And also about, many of you are asking about our upcoming overdose initiative community coaching program. We'll talk about that as well. Next slide, please. Again, guys, we're real fancy here at Project Opioid. We like QR codes. QR codes make us feel important because it's the digital age. So if you're interested in signing up for our next webinar with veterans, we're going to be doing this in partnership with the Wounded Warrior Project. How do veterans need specific help when it comes to this drug crisis and addiction in general? So register for that upcoming webinar. It's going to be on the 30th of November, and you can do that right now. Next slide, please. Again, what is Project Opioid? Let me tell you guys why it's important that we stress what Project Opioid is. We believe you need to consider doing this kind of work in your community. The federal policy on opioids is important. State policy is important. But ultimately, the solution to the opioid crisis has to happen at a regional and a city county level because all things are local, especially healthcare. So Project Opioid is about not just the what needs to be done, but who must work together at a community level. Whether you call it Project Opioid or not, we encourage all of you to gather leaders in your community to empower them and engineer the solution to this crisis. Next slide, please. So that's Project Opioid, and you need to be organizing leaders in your community. Go ahead and go to the next slide, because we believe leaders can save lives. We're doing Project Opioids around America. Project Opioids about three things. It's about building a cross-sector coalition. Again, guys, screenshot this, because this is what you need to be doing in your community. Government cannot do this alone, but government has some really important funding right now. So we're advocating for government, sheriffs, mayors, and others build a coalition that can create a solution to this crisis. Do advocacy. We'd love to help you do that. We do some of the best in America, and ultimately lead all of that group down a path to create change. Next slide, please. That's what Project Opioid is all about. And we are about leaders taking action. Build a coalition in your community. Build a leadership coalition, because ultimately, look at this slide right here, guys, where the rubber meets the road. If you're the mayor, if you're the elected county leader, if you run the health department in your community, if you're the sheriff, leaders can come together and make sure when every person reaches out for help, they get help. Take a screenshot of this. We're going to send you this PowerPoint as well. I know some of you are asking. You want to do this in your community. We want to help you do this in your community. Next slide, please. Ultimately, you can solve this. You're the solution. If you have questions, please put them in the chat. We want to try to answer as many questions as possible. We try to ultimately answer as many as we can, but if you put them in the chat, we'll get back to you as soon as humanly possible. All righty, without further ado, let's dive into the data. Dr. Kendall Cordew, PhD. Kendall, how you doing today?
I'm great. How are you doing, Andre?
Good, good. Kendall, you are one of the foremost data analysts for the opioid crisis, really in America right now. You seem to always be ahead of the curve when it comes to releasing data. And so I think many folks are going to be fascinated with this new report, this data analysis that we're launching and releasing today. I'll have my team put links to the overview of the report in general, and the recommendations in the chat. They'll also be available on our website. But Kendall, although we only have a limited amount of time, let's go ahead next slide and dive into what we're seeing. Now, this reads like an eye chart, Kendall. A lot of people aren't going to understand this, so I'm gonna give a little background here.
Okay,
guys, everyone who can hear the sound of my voice, listen to these bigger numbers as Kendall dives into this. 2022 overdoses, the data just really rolled out over the past few weeks. 2022 overdoses up again in America. I think the number, depending on where you're counting, is somewhere between 110,000 and 112,000. I've seen two numbers used because people start at different times of the year counting, but up again by every person that's measuring. Number two, for most states, fluctuation. Some states are up and some are down. And Kendall, this has never happened before, where some states are seeing increases in overdose deaths in the same time period that the national number went up. And some states have seen decreases. One more level before you dive into this. For those of you that are, again, work for the mayor in your community, you are the mayor, you are a county elected official, you're a sheriff. Guys, here's the most important thing we're seeing. In states around America, we're seeing county by county, counties right next to each other, overdoses in one county explode further to higher heights in 2022, and counties right next to them seeing historic decreases last year. Kendall, this has never happened before. This is the divergence that we're talking about today. So talk a little bit about, with that premise, what you saw when you analyzed this most recent data.
Right. So yeah, Andre, to your point, the United States has seen a continuous increase in overdose deaths, back to 2015 when we really started looking at this crisis closely. And what we've seen in the last 2 years is that instead of starting to see a decline, which we had hoped to see after the COVID pandemic, we've really seen the overall numbers stagnate at a tremendously high level. 112,000 people a year in the United States is just an insanely high number, and just really something that should be of great concern to everyone in the United States. So what we did is we started looking at where these things were happening. And to your point earlier, some states were seeing increases, some states were seeing decreases. And for the first time, we were seeing kind of pockets of states. So we looked at that and thought, well, wow, what's going on here in these states, in these regions that are making overdoses go either up or down? So we decided to look at it one step further and look at it on the county level. So what you're seeing here is the percent change in fatal overdoses on the county level. And don't worry, there's maps that are much closer than this in the report. But these are county level statistics from the CDC that allow us to look at the changes that are happening geographically. So if you go to the next slide, please, you can get a closer look at what's happening here in terms of pockets or clusters of counties that are improving and clusters of counties that are falling further behind. So we looked at this in a number of different ways, and we'll get more into it in a minute. But first is kind of looking at the geography here. So the blue counties, the counties that are highlighted in a shade of blue, are seeing improvements. So those are seeing a percent change between 60% decrease and remaining the same, depending on the shade. Like the darker the shade, the better the increase. And then in the orange counties are getting worse. So they're seeing a higher number of overdoses. So if you look here, if you kind of stand back and look at it far away, you can see that there are pockets of increases and pockets of decreases. And that was really interesting to us. Next slide, please. And so this is occurring across the country. This is kind of a picture of more of the middle of the country. And you can see that we're missing a good bit of data here. And so I wanted to kind of explain what we did. Any county that didn't have that, either we suppressed the data. So if there were too few overdoses in 1 year, then the data is suppressed, meaning we don't count it because it's too low to be statistically significant. Or if the county was missing data for one of the years, then we excluded it because you can't calculate percent change without something to compare it to. So we are missing some data, but in general, where you're missing data is probably where this has not had been as much of an issue, or where there's things that are preventing the submission of data. But this has enabled us to really look at things geographically and see kind of those pockets that I was talking about. Next slide, please. And if you look on the West Coast, we are missing more data, especially in the Northwest. But you can see in California, again, those pockets, California, Oregon, Washington, those pockets of counties that are doing better as compared to those that are not doing as well.
So Kendall, I just want to reiterate something for those that are looking at this. Leaders, look at this chart and look at blue in some of these communities that show blue, Kendall, it's a small change, but in some of them it's 10%, 20% reduction in deaths in 1 year. But then right next to those communities are communities maybe that saw 10, 20, 30% increases in deaths in the same year in the same state. Kendall, we haven't seen this before. This is brand new on the opioid crisis.
We haven't. This is really new. Usually the trends are much more widespread. And so we have a lot of hypotheses about what is going on here. And I know you'll get into that later, but this is something that really bears a lot of further research, trying to figure out what's going on in these particular counties, in these communities that are turning the tide on the overdose crisis. So, but of course, when you're looking at this, we're looking at percent change, and that does not take into account population size. That is simply looking at percent change. So in addition to this, next slide, please, we evaluated the counties, looking at where they stand from the National Center for Healthcare Statistics chart on urbanicity, or on their urban regional metro classification. So we went and looked at each one of these counties under that certain classification, and that classification again is designed by the National Center for Health Statistics, and so it takes a lot of things into account. And what we found here is even more interesting than the geographic findings, I think. And we really found that there are some, you know, even holding constant the population size or the the urbanicity of a county, there were still a great deal of changes. So if you look at this, we are comparing Illinois versus California versus Colorado, and you can see that there's still a really significant change in some of these large counties. And so if you looking at the numbers, you can see obviously Orange County, California, saw a drop from 1,300 to 1,100 in a year. That's a tremendous savings of life. And so we're really able to look at it more on a population size basis.
Yeah, let me interpret that a little bit, guys. What she's saying is, because data scientists always need a little bit of interpretation for us people who are a little slower, Kendall. What she's really saying is this: you can take two counties sitting right next to each other with similar populations, similar drug problems, and one county is going way up in deaths, and especially per capita, and another is going way down in deaths. Last year, this is the blue squares you saw. That's what those counties going down, the dark squares going up. Guys, same group of people, same drug problem. What makes one community go down? What makes one community go up? Of course, we've never seen this before. This is what we're talking about today.
Yes. And next slide, please. And if you look at some of these, so this is a medium metro county, and I just saw a question in the chat: what counties is the chart representing? The names are on the bottom. I'm sorry if they're a little small, but when you get the slides, you'll be able to see better. But some of our medium metro counties are doing better. And if you start to unpack this and look, Brevard County here in our home state of Florida saw a tremendous decrease in overdose deaths between 2021 and 2022, about a 51% increase, which is very significant. And we really saw a lot of the medium metro counties doing well on this crisis in that year. And so, you know, something to think about what these counties are really doing to help save lives in their communities. And I know, Andre, you're going to talk about that a little bit later. And then finally, next slide, please. If you look at the rural counties, some of our rural counties are still continuing to struggle. I know in the state of Florida, Alachua County, for example, saw a pretty significant increase from 2021 to 2022. And the same thing is happening in some of these smaller counties across the United States. So I think in summary, you know, this data really needs a lot more research to figure out why from a scientific perspective. But I think Andre and I can both agree that we have a pretty good idea of why and what's going on and how these counties are pulling together to save lives. And I know you're going to talk about that next.
Yeah, next slide, please. Let me just, because we have so many questions on this analysis. Go ahead and go to the next slide, please. But here's the more important. Hey, Amber, skip back all the way to the chart, the chart of the United States with the blue. Here we go. We'll stay there a second. Yeah, go back forward one. All right, just take the Northeast, right? Guys, this is, hear me and hear me well. This is what Dr. Kendall is saying. For the first time in 2021 to 2022, you're seeing some communities way up and some way down, many of them right next to each other. If we had these same charts for the past 10 years, you'll mostly see brown. You'll mostly see brown. If you look at the national numbers on overdose deaths, we have seen steady increases in almost every county in America, with very few exceptions, for almost 2 decades, and a special emphasis on increases in deaths since 2015 and 2016, and then a huge surge in 2020 during the beginning of the pandemic. So these maps normally would have been all brown with very, very few exceptions. So now look at these again. And what Kendall was showing a second ago was, if you look at small communities, if you look at mid-sized communities, if you look at major communities, the same phenomenon exists. That some big cities have seen tremendous increases in deaths. Some have seen huge plummeting numbers in deaths. So that, like, for the first time ever, overdoses are skyrocketing to higher heights in some communities, and they're plummeting in other communities. Go ahead and go on now, Amber. Thank you for going back and showing those one more time. And again, someone was talking about the 2023 data. There is no official 2023 data. The CDC and others do not put this data out in real time. We have real-time data coming in from communities we work with. We're seeing this trend in real time continue. But in 2022, which the 2022 data was just released a few weeks ago, this is what we're seeing. And it is historic, because we think what it's saying is that communities that are doing a handful of what works are seeing decreases. We see communities not doing the clear best practices on the opioid crisis. Fentanyl is winning. And so let's, next slide, please. I know some of you have asked about this, so let me just put this next slide up. This is important. This is important. What is this? These are the big lawsuits that are being settled right now, supplied by our good friend and Project Opioid board member, Harry Nelson, out of Nelson Hardiman in Los Angeles, California. But this is another reason why this is important, because if you look at this chart, it also shows that the settlements from almost every lawsuit are coming to a conclusion, and cities and counties from around America, for the first time, next slide please, are starting to get money coming in their doors. The National Abatement Program has kicked into gear in 2023. And so communities have money. Some of you smaller communities, the mayors, the counties might have 300,000, 700,000 a year. In communities like Los Angeles and Miami, or Orange County, Florida, Orange County, California, Memphis, those numbers can be anywhere from 20 million to 80 to 100 million or more a year for the next 18 years to do these things on this slide. Next slide, please. Again, we think this is important, because if you are tied, if you have leadership in a city or a county or a region, or you have connection to those folks, they have new money to be spent, and all of these states are spending it slightly different. Some of the states have more power. Some of them are kicking the money down to cities and counties. We've got, if you have specific questions on this, you can reach out to us. We're doing a coaching program for states and for communities. But the bigger point is this, folks. It appears that a clear path forward on what communities should do to prevent deaths has emerged. We believe this at Project Opioid, right at the time where money could be available to make lives, to transform lives, and to make a difference in your community. Next slide, please. It's important that we talk about how your community could be a part of the work we're doing. And what is the work we're doing? We are just coaching you on how to impact this crisis. Many of you have asked about our overdose initiative. Unfortunately, our fall initiative that starts in November is at full capacity. We cannot take any more communities into that, but we're going to be opening up registration the week following for our February session. If you're interested in partnering with us in November, December, we're going to be creating a whole list of new online tools, recommendations for you. We're going to be getting those out to you. But for communities that want to also impact this crisis in partnership with us, this is why we have our overdose initiative. You can email us. We'll be sending an email out afterward. But registration for our February session, our community session, starts November 13th. We want to partner with you to end the overdose crisis. We believe there's a clear path on how to do that. Next slide, please. Let me take a couple questions right now. Question, what is this path? What do you feel like can impact a community? We're going to dive into that in just a second, but I will say that fentanyl is what's driving the deaths, guys. This is no longer a prescription pill crisis. This is a fentanyl crisis. And so communities that are thinking of fentanyl and using FDA approved medications and naloxone, and then coming together to navigate advocacy and treatment, are seeing reductions. And so we'll deeper dive into that. Faith has the question: does data take into account possible changes in population or people moving, for example? There's certainly variances in communities that could have had major population shifts. I would say, though, that Faith, the data is so conclusive. When you talk about, I'll give you one example. We did a big Florida deep dive into the data last week with some Florida leaders. What we found is that some counties were up as much as 20-30%, while other counties were down 40% right next to them. So we're not talking about 2 and 3% increases up and 2 and 3% decreases down. We're talking about major 10, 20, 30% variances, increases in death, decreases in death. Populations don't increase 20, 30, 40% in 1 year. This data is as right as rain. Next slide, please. Next slide, please. Let's bring in Dr. Husty. Todd, are you there?
I needed to unmute. Yeah, I'm definitely here.
Got it. Go to the next slide, please. So Dr. Todd, and Kendall, stay on with me. We're gonna kind of dive into this a second. One of the things, so we're gonna dive into the recommendations and what we're seeing in communities. Number one, Dr. Husty, communities that are really implementing naloxone programs, whether that's Narcan, which so much of the overdose crisis, Narcan has done such a great job across America. The folks who have supplied Narcan for years have done a great job. Whether it's Narcan or some of the stronger versions of naloxone like Cloxato, which is double strength Narcan. That's what we tell people. It's the same substance, but in a higher quantity. Or whether it's even newer versions of naloxone that are coming on the market. We're seeing that naloxone distribution is incredibly important. What you see in front of you is a new community overdose response matrix that we did for Florida that we're also launching around America. Dr. Todd, how important is it that a community have naloxone available if someone could overdose? How important has naloxone been to communities who are solving this crisis?
So I'm the EMS medical director in Seminole County, and I get to see all of these. I work closely with the sheriff's office, and once we started deploying Narcan through all the sheriff's officers, EMS, and then the public, we have seen a drastic reduction in deaths. It's not far enough yet, but it's been got a good reduction. So it is the key to reducing deaths once they've overdosed. The other key to reducing deaths would be to try to stop it before they get there. But that's a longer haul. So first we need to be able to take care of those people who have overdosed, and we need to bring them back to life, basically, because they will die without Narcan or Cloxato.
Yep. Again, we're a big fan of all forms of naloxone. If you are tied into the distribution of naloxone in your community, we highly recommend screenshotting this or getting this chart from us. We can customize it for your state and your community. This just launched a few weeks ago in Florida. We're now doing this state by state. Your community needs a plan with naloxone. You need to understand that different forms of naloxone are going to be important in different settings. And the very simple version is if someone overdoses and they're in a setting where there's a doctor who a medically trained individual who has medical equipment, what kind of naloxone you would use in that situation is different than if someone is at a nightclub and God forbid they overdose, and the bartender or the manager of the nightclub, which happens all the time in this country, has to administer life-saving naloxone. So screenshot this. We don't want to take too much time on this, but what it's saying is that ultimately naloxone done intelligently at a community level is part of the reduction in deaths in almost every community that we have surveyed. There's a lot, as Kendall said, there's a lot more data that needs to be done on this, but I think the data we've done so far is so overwhelmingly conclusive that we can stand very confidently that there's a path forward. Four things are happening in communities that are seeing reductions in deaths, and in the communities that are not focusing on these, fentanyl is winning.
Hey,
So
Andre,
next slide, please. Yes, sir.
can I just say something about this matrix before we leave it? Is you can look at it and go, gee, that there are different strengths all over the place. You know, how much should we use? You know, we should use enough so that they start breathing again. And you really can't overdose somebody on a naloxone. So, and that's part of the teaching here is, you know, it's interesting because when we go from EMS shows up, how much naloxone has the patient received? It depends on how many law enforcement personnel are there, because they might have received, you know, 1 dose, 2 doses, 3 doses, and it's all about the same. It's just we need to get enough into them rapidly they start breathing. 100% of these people, almost 100%, will go into acute withdrawals from that. We have to be prepared for that. But bottom line is, what is the dose? Enough. And it's a very safe drug. And we need to train people that it's a very safe drug.
Yep. And if we can help you, this is going to be part of our training session. We train communities on how to implement an overdose response matrix on naloxone. But as Dr. Husty said, naloxone needs to be strong enough and available in every setting in your community. We want to help you do that. But most important, if you see the blue communities that are reducing deaths on Kendall's chart, Dr. Kendall's chart, every single one of them are deploying naloxone in huge amounts. The communities that are seeing darker numbers, which means their increases in deaths are still going up. This is probably one of the reasons where there's work that still needs to be done. Next slide, please. So based on the data that Kendall showed, here's 4 things the data is telling us right now that we really want to dive into. All of you are asking, what is the pattern that you guys believe, although this data is brand new, what is the pattern, the 4 things leaders around America need to know about the data around the overdose crisis in 2023? First of all, again, as we just talked about, next slide, please, fentanyl is still driving this crisis. Guys, everyone who can hear the sound of my voice, I'm begging you to hear what I'm saying right now. This was absolutely a prescription pill crisis 10 years ago. 8 years ago, prescription pills probably driving this crisis in a way that was historic. People ask me all the time, Dr. Todd and Dr. Kendall, hey, have you seen the new Painkiller special on Netflix, or the newest movie about the Sackler family and how they overprescribed oxycodone for years? And what do you think about that? And my comment is this: those are great movies, great shows, about 10 years too late, because now fentanyl is, in most states and in most communities, 80 to 90% of the deaths are now fentanyl, where 10 years ago, it was probably less than 10%. Kendall, as someone who has really dived into the numbers around fentanyl in communities, what are your thoughts on this drastic change from 10 years ago to today on the fentanyl causality of overdoses?
Yeah, it's undeniable. And if you look at the data from the CDC, if you look at the data from anywhere, including local data, it's very easy to see that fentanyl has just dramatically increased since about 2015. It came on the scene. 2017, things increased, but by 2020, really the initiation of fentanyl into the drug supply and collided with the COVID-19 pandemic and really fueled this crisis. And the data is very clear that about 89 to 90% of overdoses in the United States were attributable to a fentanyl overdose.
Yeah, it's astonishing. Again, so those of you that work for your mayor's office, you're the mayor of your community, you're the county commissioner of your community, you work for the hospital system in your community, you're the sheriff. Law enforcement, guys, knows this more than anybody, right? Law enforcement sees every single day fentanyl killing people in waves. We're not saying that people aren't taking all kinds of drugs. You're seeing methamphetamines still everywhere in America. You're seeing all kinds of drug mixture cocktails, but it's fentanyl that is mostly killing people. And so that's why we have to continue to move away from some of these policies that were focused purely on limiting prescription pills. I'm not here to tell you that we shouldn't still be vigilant with prescriptions, but I would say that there's a real important conversation that could be had, that in the communities where we've seen prescriptions cut by 60, 70, 80%, Dr. Todd, maybe in times we've made it too difficult to get a prescription. And there's just a conversation that needs to be had about what we do with a lot of people who were taking prescription pills, and now they have nowhere to turn but the streets.
So, you know, we as physicians and in the medical world relied a little too heavily on opioids for pain management. And there are other ways to do pain management. And there's a place for pain management. Heck, there's a place for opioids, but it should be very closely watched and monitored. And I think we now understand the size of that problem. As a matter of fact, Patricia wrote and said something about treatment is important, but how about prevention? You know, the prevention of getting to the medical providers and getting them to scale back on their use of opioids was difficult, but it happened. I mean, it has really occurred. Our new big hurdle is recreational drugs. Oh yeah, that's been our hurdle for a long time. It's just that a lot of recreational drugs now end up with fentanyl in the equation, a killer. Before it was marijuana and alcohol and then some cocaine. Some people died, but with fentanyl, a lot of people die. So I'm not saying it wasn't important before. It's just recreational is harder, and that will be our next gauntlet to run in the prevention side. But I think we did pretty well on the prevention side, or we're doing pretty well with the medical prescriptions.
Yep. So let's go to the next slide. But again, guys, in your community, if you are seeing reductions in deaths, it is because you're taking on fentanyl and you are realizing that that's the number one killer in your community. Next slide, please. Number two, what is the data from 2022 telling us? It's telling us that young people are dying at incredible rates. I think this gets overlooked, Dr. Todd and Dr. Kendall, because I think we get so close to the forest we can't see the trees. And so let me back up just a second and say this. What am I saying here? I'm saying this, that overdose death by fentanyl, no matter where you live, if you are 45 and younger, because the age does change a little bit depending on your population, but if you're 45 or younger, anywhere in the United States, the number one cause of death now is death by overdose, almost exclusively by fentanyl. So this is killing. When you talk about 112,000 people dying, this is killing young people in extraordinary high numbers. As Dr. Todd alluded to a second ago, we also see in the data what I will call deaths from those that are opioid and fentanyl naive. We have increasing numbers of young people who are dying because they think they're taking an Adderall or a Percocet or some kind of recreational drug, Dr. Todd, but they're actually taking fentanyl without even knowing it. Let me go to Kendall a second. Kendall, in your data, are we seeing increased numbers over the past 5 years of young people dying who maybe don't even know they're taking fentanyl?
Yeah, absolutely, Andre. I've talked about this in other areas as well. It's one of the most frightening parts of this crisis from my perspective as both a researcher and a mother. The overdose rate for children or individuals between the ages of 0 and 24, which is how the Kaiser Family Foundation tracks it, increased 90% between 2019
Crazy.
and 2020, and then another 20% between 2020 and 2021. And it's heartbreaking, and it's absolutely scary. And to Dr. Husty's point, we've been dealing with the drug epidemic for a long time in this country. Back when Nancy Reagan said, just say no in 1984, and the drug seeking behavior of our children haven't changed. But what's changed is the drugs that they're encountering when they get onto the streets, and it's so much more dangerous now. It's just very frightening.
We're going to talk about this more in our webinar with the Wounded Warrior Project. Don't forget to sign up for that. The link is in the chat. But I would say this, though, as well, before we go to our next slide. We promised to get you guys out of here in 20 minutes. I know we talk a lot, but we are passionate about this. And we know that you and your community need this data and that you can solve this crisis. But here's something else. Listen to what Dr. Kendall just said. In your community, drug use is not up. Drug use, not right, Kendall? People are not taking more drugs. What is, but in that same time period, deaths are skyrocketing. Another thing, think about what Dr. Todd just said. Prescriptions are down 50%, 60%, 70% over a 5-year period of time to oxycodone, right? In that same period of time, deaths went up by 50%. Think about those, guys. So what is up? Death by fentanyl. I would also say what's up is anxiety and depression and mental health among our young people. Go to the next slide. We have a few questions or comments. Andrea asked, what role does fentanyl test distribution have in a community response? I would say this, guys, there are clear harm reduction strategies that your community can put in place. We are in favor of all of them. Fentanyl testing strips just became legal in some of the states. They've been legal in others for a long time. Putting in place naloxone programs, giving people tools who are going to put their life at risk isn't saying that you're okay with them taking drugs. It's just being responsible. So we think that's a great point. Thank you for that. Patricia, Dr. Todd talked about this. Next slide, please. But treatment is important. Guys, let me just say this. This is so important on the treatment side, guys. Prevention, treatment is critical. Prevention is so important, but I think we got to separate prevention, next slide, please, from harm reduction, because dead people, this is in Florida, but I would say this, we're seeing this, next slide, please, all around America. We're seeing that. Guys, look at this. Screenshot this. Your community needs to be bringing your leaders and your response together to target the most vulnerable. Kendall, we've seen this over and over again in the communities that are saving lives. Government, cities and counties are working with law enforcement, sheriffs, chiefs of police. They're working with the hospital systems. They're working in collaboration with partners to target the most vulnerable and at risk. Guys, we're going to do a deeper dive into this in our veterans webinar next month. Don't miss it. But here's what we're seeing in the blue communities that are reducing deaths. They're targeting where folks are most vulnerable. Where are they most vulnerable, guys? It's not about targeting neighborhoods by itself. It's about targeting the emergency rooms and those coming out of your criminal justice system as a starting point, along with vulnerable neighborhoods and broad-based opportunities and advocacy. So ultimately work, and there's no wrong door. Dr. Todd, how important is it when somebody or a family member of that somebody reaches out for help? That means for that one moment, the opioids are giving them a rational thought to try to save themselves and save their life. Todd, Dr. Todd, how important is it that they get urgent treatment when they reach out for help?
We need to be able to provide that treatment now. I mean, that's the hard part. It is difficult to be able to set that up instantaneously. It is not going to be an instantaneous thing. Although you can enlist the emergency departments. I noticed that somebody from McKinney, Texas EMS wrote in. And so EMS is actually starting to get involved, training the paramedics to be able to initiate buprenorphine treatment in the field, but then you have to have someplace to take them. So you're starting to look at what is this going to take to make it all happen. But getting EMS, the first responders, and the people in the emergency departments, it's one thing to life, having law enforcement do that, but then you need to seize that moment and get them on buprenorphine. Or maybe they're at home with their family and say, I'm done with this, I need treatment. And you should be able to call EMS and get treatment. That's a big jump from where we've been in the past, is to include a treatment for something and then move them not necessarily to an emergency department, but to the next facility that is going to continue their MAT. That's what we're working on in our county. I can tell you it's not easy, and we're still not all the way there, but we're getting closer. But it takes a lot of work. I did want to point out one last thing, and on the one slide, we really got going when Sheriff Dennis Lima, the sheriff in our county, said, I don't want to make bad people good. I want to make sick people well, and we're going to start in the jail. So we take people that are still in the criminal justice system, we begin their MAT there and follow them up in the health department. And a lot of these people are working now. So captive audience. And you know what? They actually want off the stuff. And if you can keep them from having cravings by using MAT, they can become productive again. That's really working well. There are a lot of pieces to the puzzle, of the solution puzzle, but it takes a lot of different players.
Yep. Dr. Todd, thank you for that. We've got 14 minutes left. I want to address a couple questions here. Well, everyone listen to this real quick. There's some questions about xylazine, about how naloxone only works on opioids. These are all really good questions. Remember though, Dr. Kendall, how 80-90% of the deaths in most communities are fentanyl. Is that
Correct.
a fair statement?
Mm-hmm.
Okay. So we can't prevent all deaths, but in theory, if there was naloxone available in every situation where someone was overdosing, and if we had medication-assisted treatment available for them before they overdosed or after they overdosed, we could, I know that seems pie in the sky, Kendall, but if that was the case, that we got 80-90% of those that died of fentanyl, there was naloxone available and medication-assisted treatment, isn't it fair to say you could cut deaths by 80-90% in that world?
You could definitely make a significant impact. I mean, getting those two things into communities is what is making those orange states blue. I mean, that's really
Yes.
making the huge change.
Guys, everyone on this webinar, listen to what we just said. It's so critical. The cities and counties that are seeing huge reductions are preventing overdoses with naloxone, and they're also giving people medication-assisted treatment. This is what's working. We have critical new dollars. We can work together, number 4, to solve this crisis. This is so critical that we move resources towards what can work. Again, we have our fall overdose initiative. I know some people are asking about this, that I'm getting texts. Our November 7th community initiative, we have a great cohort who's starting there. It is full. We cannot take any other communities. But in November, we're going to start our signups for our February session. We want to help you do an overdose initiative in your community. We want to help you bring your community together, implement programs. We know you can be one of those communities that's cutting deaths at historic numbers. Next slide, please. More information about that in the days to come. We have a couple other questions I want to address. Again, I think we talked about prevention, the greatest prevention programs that we're seeing that are effective financially. Guys, think about this. If someone's struggling with drugs and you tell them that the only path is to go to an inpatient facility, how many people can afford that? How many beds are available? Guys, with the amount of millions of people that might need treatment in the next few years, we've got to think about getting people treatment that's focused on medications, and that we get them the medication right in their community and in their home. They need counseling. We can offer them counseling even virtually, as your community can offer them that. So next slide, please. We got to think about using money on things that work. 5 things really quickly that the data is telling us that you need to do. Some of this is redundant, but I can't help but stress it enough. Next slide, please. We are seeing naloxone anywhere and everywhere. Folks, it's not just about having naloxone with law enforcement. If you're law enforcement and you're on here and you're not carrying naloxone, I'm begging you to please reconsider that. We know most sheriffs and chiefs of police are mandating the lock zone now. Most mayors are mandating the lock zone for their law enforcement. Counties are mandating it when they can, but it needs to be everywhere. We have programs that we coach. Have naloxone in your schools, in your high schools, in your colleges, bars and restaurants, critical places for naloxone. Think about where your 45, 35, and 25-year-old folks are. That's going to be bars, restaurants, and schools, and have naloxone there. We were at a prominent hotel. I'm not going to tell you the name of it, in a big community in this country. I mean, you would know the name of this hotel if I said it to you. And in one of the resorts capitals of the world, they talked about a young man. This was just a few weeks ago, that security in the hotel responded to a young man going down in his room, 25 years old. His wife's there. His little child is there. He was overdosing. He took what he thought was an Adderall someone had given him. They did not have naloxone. This young man died in this hotel, and they were begging us, help us get naloxone. Your community needs to make sure that's available. Again, make sure you take a deeper dive into this. You're going to need to have different types of naloxone available. This was made for Florida. Florida only has Narcan and Cloxado available through its Department of Children and Families. We're asking you, look at your state, look at your community, see what's available, have the strongest forms available for your state, and we can help you and coach you on that. Next slide, please. As we start wrapping up this webinar, what do you need to do? What does the data say? Why are some communities seeing historic reductions? Others are seeing huge increases. You got to expand medication-assisted treatment, guys. MAT, medication-assisted treatment, on our veterans webinar. Don't miss our veterans webinar with Wounded Warrior Project, November the 30th. The link is in the chat. We're going to dive deeper into medication-assisted treatment in our veteran-specific webinar. How do you offer these programs for everyone in your community, but uniquely partner with your VA to impact veterans? But folks, medication-assisted treatment is what is absolutely working, and there's newer forms of it. I know methadone has controversy to it. We're not against methadone, but we will tell you, as a full agonist method, what that means for those of you that don't understand that nomenclature. That means that methadone works, but it also can be addictive, and it also can be something that alters someone for a day or for a lifetime. We're not against methadone, but we would say there are newer forms of medication-assisted treatment that are absolutely not addictive and can change someone's life. We want you to learn about those, and we want you to invest in those. They're cheap and they're effective, and every community in America that is seeing reductions is doing extensive medication-assisted treatment programs. Next slide, please. What do you need to do? What is the data saying you need to do? Educate your young people. Educate your young people. Why this is important is because we're seeing increased deaths among young people that don't know they're even taking drugs. We need to educate parents as well. So we need to educate our young people so that they understand how deaths are taking place because of fentanyl. Robin Falk had a really good question. I'm going to dive into that really quickly. How do you find out more about training for EMS to initiate BUP in the field? We will put some information on that into our next veterans webinar. We encourage you, but I would say that is the right question. How do we get hospitals, EMS, others with these medication tools? That's a key question. We got to educate our young people. Next slide, please. I'm going to be respectful of your time. We're going to get you out of here in time. Next slide, number 4, collaborate. We can't stress this enough. Everybody listen. The reason collaboration is important is because you must create a treatment pathway for those struggling and the families of those struggling. And so the only way you can do that is if the city and the county and the jails and the hospitals and other providers are working together. That's why that is so critical. So collaboration is sometimes important. With the opioid crisis, it's critical. Next slide, please. Also, it's important to note, again, our overdose initiative. Some of you are asking about this. Please contact us. We have no more room in the inn for the fall session, but next year we're going to be starting our new session. 20 communities working with us. Contact us if you're interested in that. As in the last few minutes, I just want to, we have 6 minutes left. I'm going to answer a few more questions. But I also want to stress the importance of compassion, having a heart that's filled with love and grace for so many people that are struggling and so many people that are dying. Next slide, please. We know that deaths are happening, and we need to put together our coalitions and have our coalitions filled with grace and love. These are good people who are struggling with drugs, not bad people. Obviously, one of the groups most impacted by behavioral health issues, mental health issues, are our veterans. Don't miss this webinar. We got 4 minutes left. Click on the link, or you can sign into the QR code right now. We want you to be a part of this conversation around veterans. We're doing November 30th. Project Opioid only has these webinars for mayors, county leaders, health department leaders, sheriffs, law enforcement. We don't invite anybody else, other leaders in the space of the opioid crisis in communities around America. Dr. Kendall, Dr. Hussey, we got 4 minutes left. I just want to, Dr. Todd, there was a lot of questions about xylazine and tranquilizers and methamphetamines. How do we think about those newer emerging drugs in an environment where 80 to 90% of the deaths are fentanyl, but we're seeing a lot of other drugs on the scene? Dr. Todd, how would you advise a mayor, a county leader, a sheriff, a chief of police? How do you advise them to think about all drugs right now?
So there's a lot of mixture of the drugs. So somebody that is taking tranq might also be taking fentanyl. Is what does the person look like? If the person's not breathing, they're turning blue. You're going to do the same thing every time. You're going to call 911. You're going to administer Narcan if you have it, or excuse me, naloxone if you have it. And you're going to start CPR, because not the lip lock part, just the chest compression part, because chest compressions move air. You got somebody that's not moving air, you need to move air. And if you have more naloxone, have somebody try another one. But you do that for whatever drug or condition they may have, then you've called 911. And if they're still not awake, well, maybe it is something else, but you have not hurt them by taking that stance. It's very simple. So, but naloxone is an important part of that.
Got it. So let me come to Kendall with this. I think this is a good question, and it's a very fair question. People don't know the answer. It's a good question. Can someone abuse naloxone? Is naloxone dangerous? Dr. Kendall, we've pretty much seen that Narcan, Kloxxado, any of the forms of naloxone, probably the most harmless drug, if you will, out there. Are there any dangers, Dr. Kendall, to having naloxone around in communities?
No, absolutely not. As Dr. Hussey just mentioned, if you see someone and you give them a dose of Kloxxado, Narcan, whatever, you're not going to hurt them. I carry around naloxone in my car with my children. It's a safety thing. It's like having a fire extinguisher around. You hope you never have to use it, but if you do, you're going to be sure glad it's there.
Got it. There was a question in the chat. Go ahead, Dr. Todd.
I just see a question about carfentanil. I just met with our folks in our county. They haven't seen carfentanil in our county in 2 years. And that might be because it is so potent, and fentanyl is not a good business model, because everybody you sell the carfentanil to dies. So that it's sort of, it's taking care of itself as a problem.
I would say, though, that in the numbers that you're seeing, that includes all overdose deaths, with the caveat that diving into all the overdose deaths, 80, 90%, depending on your community, are fentanyl related. So carfentanil would be in there, although I agree with Dr. Todd that we're seeing less carfentanil. We're actually seeing more tranq, more xylazine, more drug, all types of different drugs. We're still seeing that, but fentanyl when it comes to death. Michael, Ann asked about, has anyone heard, the last question, we're going to let you guys get out of here. Has anyone heard about Narcan assisted rapid Suboxone induction? Here's the simple answer, and it's such a great question. The simple answer is your community can solve the opioid crisis if you have naloxone available, you're working together. And Dr. Todd, I'll give you kind of the last word here. What this person is saying is, if someone overdoses, let's bring them back to life. Let's try to prevent that overdose before they overdose, by the way. But if they do overdose, what an opportunity. Save their life and then begin medication-assisted treatment right there, right? This is what, whether it's coming out of the jail, whether it's EMS. Go ahead, buddy.
Almost 100% of people that receive naloxone end up in acute withdrawal, opioid withdrawal. That's when you're supposed to wait to give MAT, buprenorphine. They have to be in, they're supposed, well, you already have them in withdrawal because they just came back from the dead. And that's a great time to start their buprenorphine. Oh, and they'll stop being in withdrawals. So combining those two together, I think is what the question was, is perfect. So you got to get EMS involved and the ERs involved. You got to get everybody involved.
Huge thank you. We're out of time. Thank you, Dr. Todd Husty. Thank you, Dr. Kendall Cordew. And thank all of you. Don't miss our next webinar. Sign up right now. And together, we are going to see more lives saved, more lives transformed. Thank you, each and every one of you, for the work you're doing. We will see you next month.